we want to look at the tubal status, and this is examined with a hysterosalpingogram or an HSG. And this is an X-ray where we inject a dye into the cervix, and you can see on the left side of your screen, this is a normal test where the outline of the uterus is normal, and you can see the thin path of the dye going through the fallopian tubes on both sides. And then you can see the fimbral folds here, and it's normal. And since the patient is laying on her back on the X-ray table, you can see the dye just spreading out throughout the pelvis, and this is a completely normal study. To contrast that, on the right, we see that the tube fills up with dye, and it fills up like a sausage. The dye is confined to both tubes and does not spill. This is called the hydrosalpinx, and when this happens, the fluid that accumulates in the tube is toxic to the embryos, and it has nowhere to drain other than back into the uterus. So it's important for patients that have hydrosalpinges. They may already know that their tubes are blocked and they need to do IVF, but doing IVF with the hydrosalpinx in place dramatically reduces the success of IVF, because the fluid, like acid rain, is draining into the uterus and will cause the IVF to be unsuccessful, and it will damage the embryos. So the important thing when you do have hydrosalpinges, it's important to do laparoscopy surgery and actually remove or disconnect the tube from the uterus. My recommendation is to remove the tube. It has no positive function, and it's not necessary to have a baby. You just need a uterus that's healthy and ovaries with eggs.